We could, if we wanted to, head to the supermarket at 3 o'clock on a Sunday afternoon. But could we get an appointment to see our GP then? Or have a routine NHS operation on our knee? Probably not. But all this could be about to change under plans by the Health Secretary Jeremy Hunt to make care in the NHS in England truly 24/7. In fact, data shows that mortality rates actually increase during out-of-hours provision. But doctors say the proposals won't work in a service already overstretched. Former doctor and author of NHS SOS, Raymond Tallis, gets on his soapbox.
I was a hospital doctor for 37 years, and in the 1990s advised the government on care of elderly people. And nothing would have pleased me more than be able to offer comprehensive care in the NHS 24/7. Surgeries will be open 7 days a week, so patients could see their doctors without missing work. In NHS hospitals, the care on a Sunday night will be just as good as the care on a Wednesday morning. This would not only be patient-centred, of course, but also staff-centred, because it would make it easier to deliver, promptly and safely, everything we want for our patients. But it would be irresponsible to support Secretary of State Jeremy Hunt's call for a 24/7 Tesco-style service at present.
Here I've been working a week, 5 hours, just living for the weekend.
Why? Well, the NHS is facing £20 billion worth of cuts. Massive staff reductions, closure of A&E, and closure of some hospitals. And all of this in the context of the most expensive and disruptive re-disorganisation in its history. No wonder services are overstretched. Worse still, resources will become scarcer as government plans for wasteful privatisation unfold. There will be expensive tendering processes overseen by lawyers, and taxes will be diverted into profits for multinational healthcare entrepreneurs. Any extension of services, something that the vast majority of doctors support, will mean endangering what is currently on offer. In other words, upgrading services at the weekend may mean downgrading the services during the weekday. Doctoring is a more complex and serious matter than shopping.
And Professor Raymond Tallis joins us now. I think everyone would agree with you that doctoring is more complicated and sophisticated perhaps than shopping. But there is a perception in the wider public also that doctors just don't want to work out of hours and weekends. Do you accept that?
Not at all. I mean, I began a 104-hour week when I was a junior doctor, and I finished part-time at 60 to 70-hour week. I regard that as part-time. By the time I finished, the vast majority of doctors do work out of hours. For example, it is perfectly normal when I retired to be a consultant on call 1 in 4 and to be on 1 in 4 weekends. And so there's no question of not doing out-of-hours care. Never mind one's continuing preoccupation of patients when one wasn't being formally paid for doing it.
Do you think that it's actually a demand that is worth looking at? You put it down to the fact that there aren't the resources there. But let's say the resources were there. Let's say more money was going to be there. Would it be reasonable for people to expect a 24/7 service in terms of GPs and hospitals?
It wouldn't just be reasonable, it would be absolutely wonderful. When I was a doctor in hospital, it was dreadful on Sunday when you were trying to solve very complex problems because you didn't have the other support services. When you were trying to communicate with primary care, there wasn't the kind of level of support at the weekends in the weekday. So, as I've indicated in the clip, it would be fantastically staff-centred as well as patient-centred. We would be far less concerned, but it requires enormous amount of resources at a time when the resources are being squandered by the present coalition's policies.
Do you accept that actually if more money was put into the NHS, or perhaps the resources were spent more wisely, you could have a more even service spread across 7 days?
There is more money being put in the NHS, £12.7 billion during this Parliament, so there is more money going in. But nevertheless, you've got to look at the root causes of this. The majority of the NHS workforce, nurses, physio, a lot of people work on a 24-hour basis. And there's a particular issue about, extending GP hours and consultant hours, because the previous contract negotiated with the Labour government on both of these saw, for example, the average GP now earns £108,000. The hospital consultant starts, I believe, on £85,000, and there was a 24% increase in pay that was given to consultants with the previous government.
Right, so,
but they were still allowed. They were still allowed as part of that contract.
So would you like to change
opt
that?
out of weekends and evenings. So actually, this part of this is about what contract we put in place. Now, are doctors well remunerated? Yes, they're very, very well remunerated by international standards.
And they should work weekends and out of hours, in your view.
There's a professional obligation, as you've just heard, for doctors not just to do on-call work at that time, but to do more routine work at other times. We know that at nights and weekends, mortality rates are 10 to 15% higher. So it's about good patient care and saying when you're well remunerated, when you're earning £108,000 on average, when you're starting your salary as a consultant on £84,000.
But hang on, I don't understand. What are you blaming the fact that you're 82% more likely to die in the NHS after having an operation on a Sunday compared to a Monday? Are you saying here that there are enough resources, so doctors just aren't good enough at the weekends?
No, that's not what I'm saying at all.
Right, well somewhere there's a problem, isn't there? Because otherwise, why are you 80%?
The problem is the contracts that were negotiated with the previous government allowed consultants to opt out of weekend care, and that meant, and we know that actually consultant-led care, rather than consultant-led care is safer care and better care, and that's something that we need to see more of, not just during the weekdays, but actually in the evenings at weekends. That's good patient care, and it's good actually professionals acting with professionalism.
What about, yes, Rosa, what do you say to that?
I think there's two confusions of what Dr. Poulter said. First of all, he's confusing the situation with primary care and the situation in hospitals. Pretty well all hospital consultants provide cover over weekends on a shift basis.
That's an on-call cover. That's different. But actually
being at the hospital,
it's not actually being at the hospital delivering care. It's actually providing on-call cover. That's very different to providing routine daytime care.
I can only speak for myself and my colleagues, but over the years. But the other thing is that there is only a certain number of hours an individual doctor can work. It is highly inappropriate for a doctor to work a 100-hour week, as I did when I kicked off. So we will still need more doctors. You can't just say spread Dr. X over a 168-hour week. You just can't do it. So you still need more doctors.
And there is a recruitment problem. We're not going to get those doctors online.
We are recruiting more consultants. The more consultants have been going to the workforce. The previous government started that because they recognise that consultant-delivered care is better care. It's exactly what we're both talking about. And that means that we need to have more consultants working at weekends and out of hours. It's also the case that we need to have a GP system that doesn't just look at daytime care, but actually provides care in the evenings and at weekends to keep patients more out of A&E when they don't need to be there and take pressure off hospitals.
Well, you're the government, make it happen.
Well, we've got to renegotiate the contracts we've inherited from the previous government that gave doctors massive pay rises,
3 years,
that reduced productivity. Well, the contracts, of course, some of these contracts come around in a 10-year cycle for renegotiation.
Right, just finally,
briefly. Let me give you an example. City and Hackney, idealistic GPs wanted to claw back their opt-out, they opt-out from providing out-of-hours services. The existing private provider was awful, and the public and the doctors all agreed with that. They tried to buy it out, and they were prevented from doing so.
The rules laid down by the previous government.
We're going to have to finish it there.